Good afternoon, and welcome to this week's edition of the on-record portion of the Rockbridge Report. I'm Jessica Straight, and joining me today is Suzanne Sheridan, the Executive Director of the Free Clinic. Thanks for being here today.
Oh, my pleasure. Thank you for having me.
Well, Suzanne, can we just start off, can you just kind of explain what the Free Clinic does in Rockbridge County?
Well, the Free Clinic provides medical care, dental care, and prescription medication to low-income, uninsured people that are living in the Rockbridge area.
Okay, and what kind of specific services does the Free Clinic provide?
I like to describe the Free Clinic as being, your local doctor's office, your local dentist practice, your local pharmacy, all kind of rolled into one package. We provide a wide range of medical services, a complete dental practice. We have a state licensed pharmacy. We also are able to coordinate care with specialty clinics, with Stonewall Jackson Hospital, and other medical practices.
And how many patients use the clinic per year?
We have about 2,000, current active patients, and we've identified about 5,000 others in the county that could qualify for services.
So, what makes someone eligible to use the services that the Free Clinic provides?
First, they need to live within the Rockbridge area. Our neighboring counties also have free clinics in them. So we specifically serve the Rockbridge area. The person would have no health insurance. And then we do have income guidelines, which are set at 200% of the federal poverty level, which means for a family of 4, that would be about $44,000 per year.
Okay, and how long has this clinic been a staple of Rockbridge County?
The clinic started in 1992, so it's been around for 18 years.
And what really prompted the need for the clinic?
There was a man that moved to the Rockbridge area. His name was Don Miller, and he had seen free clinics in practice in other states. And he was able to pull people together, and the doctors that we needed and the pharmacist, and it was just really a grassroots movement to meet the medical. It started specifically as a medical clinic, but to meet the needs in the community.
And you guys were at a different location in 1992 than you were now.
We certainly were. Again, the Free Clinic is purely grassroots. It actually, the first few months that it actually operated out of the local health department, and then moved to 712, I guess, now South Main Street. It's where the local food pantry is now, if you're familiar. And then now we're currently out right off of 11 North across from Walmart in a renovated building. And
you guys just had a fundraising campaign yesterday. So can you talk a little bit about that and what went into the project?
That was something relatively new for us. We started in March, and it was an effort to really raise awareness within the community about first, just the needs and how the Free Clinic may be able to help. And so we spent quite a few months with informational tours and that type of thing. And then we did have a breakfast yesterday morning with a video in a direct attempt to raise money.
And I think the title, it was kind of Celebrate a Healthier Tomorrow.
Celebrating a Healthier Tomorrow, that's right.
So can you kind of talk about where that came from and what the meaning is?
Oh gosh. I think our whole effort to that point was about hope and changing lives through hope. And our method, of course, was providing health to people that may not otherwise have it. And then the culmination yesterday was just to be able to celebrate that within the community. We had patients at this breakfast along with current and hopefully future donors. So it was about celebrating health in our community and how this community can make a difference to a lot of lives.
So where does the Free Clinic get its money to operate?
Almost all of our funding comes from this community in some way. Our largest source of funding comes from individuals in the community that make gifts. We have a budget of this past year $650,000 per year. We do get some grant funding. We're a United Way agency, and we do get some funds that come to us from our state association, but there are no mandated state or federal funds that come to the free clinic. We're strictly private nonprofit.
So how much money were you guys hoping to raise from the fundraiser?
Well, again, the fundraiser was targeted at supporting our operations, and we have an operational need of $650,000. And it's also a cumulative. It's based on a legacy society of pledged gifts, so it will be a cumulative effort.
And will this become a kind of annual tradition every year?
Yes, I think it will.
Okay. And shifting gears a little bit, how do you think the new healthcare reform might affect the free clinic down the road?
Well, see, that's a question we're all trying to figure out. I think from a free clinic perspective, and I think it goes back to our roots. I mean, we're here to meet, Rockbridge's unique healthcare needs, and certainly what they looked like in 1992, it's very different in 2010. And I think it'll be different in 2015. Whatever that is, I will say that right now Virginia ranks, last I checked, was 48th in qualifying poor adults for Medicaid. And healthcare reform, of course, is looking at increasing the eligibility for adults on Medicaid. I think the unique need in this area will very possibly be access to health care. It's one thing to have insurance, it's a whole other thing to find somebody that's able to provide the care that you need. And most likely, without committing myself to anything at this point, it will be providing access to care to people in need.
So you guys, obviously you don't have all of the resources like surgery, chemotherapy, MRI, so how does that work? You said earlier you refer them to Stonewall Jackson, or?
We provide those services by referral. So for example, a specialty service like surgery will see free clinic patients with our referral. So they'll see them in their offices. And we're also able to refer to Carilion Stonewall Jackson Hospital for diagnostic testing, blood work, radiology, and other physical therapy, other types of services like that.
And how many people meet the eligibility requirements in the county?
Interestingly, about 1/3 of the county population would be considered poor, over 10,000 people. Some of those have some type of insurance, some of those are children, but our target population is about 5,000 additional people, in addition to the 2,000 we're seeing right now.
So where do you think all these people were in having a voice for healthcare reform? Because these are the people that it would most directly benefit.
Well, I think we have to keep in mind, the danger of generalizing, but this is a silent population for the most part. People that have never had health insurance. I mean, we see a wide range of people. Some have college degrees, but then some people can't read. And finding an avenue for that voice, and certainly I see the free clinic as being an advocate for people that are low income, that don't have health insurance. But it's really a silent population for the most part.
What do you think will be the single biggest challenge that will face the free clinic?
Probably helping the general population understand that healthcare reform is not the complete answer for some people. And we can look at Maryland, and that has their state has a health insurance program, and still 6% of the people in Maryland don't have health insurance or any kind of direct health care, and they still have organizations that are like free clinics taking care of that population. So it's a huge step to help a lot of people, but it's just not 100%.
And can you talk a little bit about, you guys function a lot with the help of volunteers.
We do.
So how many do you guys have?
We have about 100 volunteers, from the doctors to administrative help. Students from WNL are part of that as well.
Okay. And really quick, what are your thoughts about what's the difference between just a community health center and something like the free clinic?
There's a lot of similarities. We're health safety net providers. The difference being that free clinics focus primarily on the uninsured. Community health centers provide service to the uninsured, but it's a business model that requires a mix of people with insurance, and people without. There's also a difference in funding, a huge difference in funding. And where a free clinic can go wherever a community wants it to, there are limitations to where a community health center can go within communities, if that makes sense.
Okay, well, thank you so much for joining us, Suzanne. Thank you for joining us. I'm Jessica Straight with the On Record portion of the Rockbridge Report.